Hi, my name is Dr. Luisa Kimelli. I'm the director of the Emotional Health CBT Clinic and a psychologist. Today I will be talking to you about depression, focusing mostly on what is depression and what are some treatments that we know are effective, and also discussing a little bit how common depression is and what some of the causes are, and ending with some tips. So what is depression? It's really a bunch of different symptoms. I like to think of them as in, different categories in a way. So you have the emotional symptoms. So most often, sadness, feeling down. But you can also have feelings of guilt, shame, worthlessness, hopelessness. So those are all, emotional symptoms of depression. And in parallel, so you have these sort of negative emotions, and in parallel, a lot of the times you have a lack of pleasure, lack of motivation, lack of interest. So there's a lot of negative emotion and a lot of positive emotion that is missing. Then you also have the cognitive symptoms. So people having, difficulty just thinking, making decisions, concentrating. So it's, the mind being sort of in a bit of a fog. You have the behavioral symptoms. So what people could see if they were, looking. And there you could see, crying, a lot of decrease in activity, people just, disengaging from their lives. So decrease in activity, isolation, refusing or just not engaging in social contact. And then you have the physical symptoms, which tend to be less energy, fatigue, and changes that can go in both directions in terms of sleeping. So people either sleeping like way more than they normally would, or sleeping a lot less, like having trouble sleeping, so insomnia. The changes at the level of eating, so people eating a lot more than they normally would, sort of craving carbs, and in a way it can be like almost an attempt to make themselves feel better, or the opposite of people struggling with appetite, like having to force themselves to eat because they just don't feel like it. And you can also have changes that we call psychomotor, so where people are either, most of the time it's a slowing down, so sort of, just being more slow in their movement or in their how they talk and so forth, or the opposite, where you have agitation instead, so it's a speeding up of the motor behavior. If we talk about diagnosis, like per se, official diagnosis. So depression is a mood disorder. It's called really major depressive disorder. It's 4 of the symptoms that I've talked about, plus you need either depressed mood or a loss of pleasure and interest to get a diagnosis. And the symptoms have been there for more than 2 weeks. And we're talking about really a significant change, so there's either a lot of distress that is present, so the person is still managing to do what they need to do, but it's really, really hard, or a decrease in functioning, so they're just, letting go, either at work or at home, social functioning, so forth. It's not due to another medical condition. There's not a better explanation for it. So then you get a diagnosis of depression. I thought that in the context of COVID, I would mention adjustment disorder, because people may or may not end up meeting diagnosis for depression, but may instead meet diagnosis for an adjustment disorder. And the difference here is that in an adjustment disorder, there's an identifiable stressor, in this case, a pandemic, and you have emotional or behavioral symptoms that appear within 3 months of the stressor. So like the two are closely linked together. The symptoms are significant, so there's a lot of distress that's out of proportion with the stressor. So I think it's okay to say that with COVID, we're all experiencing some stress for sure, and some people, some distress that can be normal. But we're talking about an adjustment disorder when you're just not adjusting well if you compare to other people or what would be expected given the situation. Or there's significant impairment in social occupational functioning. So, not being able to work really, it's not that there's an impairment in social functioning and that you're not seeing your friends because it's a pandemic, but it's more like you can't handle dealing with people, sort of thing. And you don't meet the criteria for depression because, if the criteria for depression is met, then the diagnosis is that of depression. But if it's not, so it's not as, intense as depression, it could be an adjustment disorder. So not adjusting in a healthy way to a very difficult situation. So how common is depression? So there's really two ways to ask the question. So one is, if you look at somebody's life or the lifetime of people in the population, what's the likelihood that at some point in their life they will meet criteria for depression? And here we have about 8% of the population in Canada that would meet the diagnosis for depression over their lifetime. A second way to ask the question is, right now, at this moment, if we went out and were able to sample all Canadians, like what percentage of Canadians are depressed at this point in time? And here the number's about 5%. Unfortunately, many people don't seek treatment. Sometimes, it can be stigma. Sometimes it's not available to them. And it's unfortunate because treatment has been shown to make a difference in the majority of people who seek treatment. The rate of depression, it's unrelated to SES, to ethnicity, income, marital status, these kinds of variables, but it does tend to be more prevalent in women. In fact, it's diagnosed twice as much in women. Now, given COVID, they are expecting to have more people who will meet criteria for depression over the coming months or coming years. Just in September, there was a study based on a survey that was published in JAMA, where they surveyed a bunch of people before COVID and they surveyed a bunch of people during COVID and looking at symptoms of depression. And they found that people during COVID reported symptoms of depression 3 times more. So there will likely be sort of an increase in the rate of depression. These numbers are huge when you think of the cost. So there's an enormous cost to the individual that is suffering, to the people who love the person and see them suffering. There's a cost, of course, in terms of the person's ability to partake in society. And really, I mean, you could think of 2 huge costs, one being the loss of life. In Canada, if you look at the age range of 10 to 30, suicide is the second cause of death. And if you look at the age range of 30 to 44, it's the third cause of death. So those are, big numbers, significant losses. And another way to look at the cost is disability. It's a leading, so depression is a leading cause of disability if it's not the leading cause of disability. And it has a huge cost, a huge financial cost of people not being able to work because of their depression. They estimate that it's like $32 billion a year in Canada. So what are some of the causes of depression? So there's really, different factors that can contribute. One of them is just an overview. So there's the environment, genetics, biology, and psychology. So in terms of the environment, what they find is that people who are depressed are 3 times more likely to have experienced a disruptive event, and usually more than one. The people that we see, it's usually, it can happen out of the blue. There could be, no particular precipitating factors, but most of the people that I see, they've been through, something difficult. So they might have lost a loved one or had a relationship end, and then, in a short period of time, something else happens. So something goes wrong at work, or, and so there's like many things that accumulate and affect them. Then there's the genetic component. So if you want to know if there's a genetic component, it's pretty easy. What you do is you take twins that were separated at birth. So you're eliminating the effect of the environment in a way. And so what you would expect is if you're going to compare identical twins that have the same genetic material to non-identical twins that have less shared genetic material, you're expecting that in your identical twins, if one is depressed, the other one's more likely to be depressed. And that correlation, you expect it to be higher in the identical twins than in the non-identical twins, right? And what they find this way is that, yes, there is a genetic component to depression. And also looking at first-degree relatives of someone who is depressed, they are, you're more likely to be depressed if you have a first-degree relative that has suffered from depression. That said, it's a correlation and it's far from a perfect one. So you could have relatives that have suffered from depression and yourself not suffer from depression, or the opposite. There might be no one in your family that suffered from depression and you do. Like, it's one of many factors and not the most important one. In terms of biology, you have, changes at the level of the neurotransmitters. A big one that you probably already know is serotonin, because the most typical medication that's used for depression is SSRIs, which are selective serotonin reuptake inhibitors. So basically what they do is they inhibit the reuptake of serotonin in the brain, so there's more serotonin going around. So in other words, the serotonin is not being cleaned up and taken out, it's staying so that you're increasing the serotonin. So that's, one example of the changes that is occurring at the level of the neurophysiology. Then if we look at neuroanatomy, there's also, different changes there when they look at people with, using MRI technology. And, for instance, you find that there's less activity in the frontal lobe, which, goes well with the fact that people are less active, they're less likely to initiate activity, and there's more activity in the amygdala, which is more involved in emotion. So here you have like the production of more negative emotion, if you will. I mean, those are all theories, but they do have some implications for sure. And then, so if we look at the psychological factors, It's a bit of the chicken or the egg and the egg in terms of, is it a cause? Like, are negative thoughts a cause of depressions? Depression causing negative thoughts? Probably a bit of both, but we can't deny that negative thoughts is clearly involved in maintaining depression. And so what you see is what is called the depressive triad. So it's people having negative thoughts about themselves, about the future, about the environment. And you can see how this would play out in the context of COVID as well. So, many people are being, less productive, or they're not, they're maybe eating more. And so then they'll criticize themselves for that. So it's like negative thoughts about the self, then negative thoughts about others in the world, about how this is being handled, negative thoughts about the future, who knows, when this will be over, and are we going to ever go back to how life was? So, there can be negative thoughts about the future as well. And then in terms of behaviors, well, as I mentioned before, you have, strong withdrawal and avoidance from activity and people. So what can we do? That's the big question. So the first thing that I would mention, I think as number one would be to rule out other issues. So I would suggest, if you're struggling with depressed mood, have a medical checkup, especially because, different problems can cause symptoms of depression. So for instance, like an underactive thyroid might cause feelings of depression, or if you have sleep apnea and you're just not sleeping well at all, that can definitely affect your mood. So you want to make sure that, health-wise, aside from depression, that you're doing well. And then the two main choices are really antidepressants or therapy. And what research shows is that in the short term, both seem to have an equal effectiveness. So whether you take antidepressants or you try CBT, in the short term, it probably gives similar results. Now, CBT seems to have an advantage on the long term. So if you measure symptoms of depression 3 months after starting treatment, 6 months, 3 years, people tend to do better, which makes sense because you're learning new tools, you're learning strategies to cope with emotion. But then, in terms of making a decision, it's really a personal decision. Some people prefer medication, some people prefer therapy, and some people say, let's do both. It's also a function of severity. So for people who are mildly depressed, they've shown that antidepressants are really not much better than the placebo. But for people who are moderately depressed, that's where you're going to get a good effect of both antidepressants and of therapy. And at a level of depression that is severe, then I think you really do want to consider medication, because then what happens is that it interferes with the ability to even engage in the therapy. If someone has trouble even just, getting out of bed, it's going to be hard for them to do some of the work that is involved in therapy. Now, which antidepressant would you be prescribed? Well, that depends on the specific symptoms that you're presenting, the side effects of different medication or interactions with medication that you're taking. Some doctors will take into account if you have a family relative that responded well to a certain medication, well, let's try that. There's also the issue of cost, which actually works, it's an issue for both medication and for therapy, something to consider. Now, something that I find sometimes people don't always realize is that when we say that a treatment is effective, when something has been researched, which I think is a big advantage of CBT, that it's the psychological treatment that has had the most research done. But nonetheless, when you do research and you say that a treatment is effective, what you're saying is that if we don't give the treatment to one group and we give the treatment to the other group, the group that has had the treatment, they do better on average. Like the mean of the symptoms is, better than in the other group. But in that group, so enough people did better to show that it's effective. And it's not, just one person that got so much better that they're driving the effect. But usually what happens is, there's some people benefited a lot, some people didn't really benefit, and you have everything in between. And so for an individual, let's say that I'm going to say, okay, I want this treatment because it's been shown to be effective. Well, for me specifically, we don't know if it's going to work. The only thing we can do is try, and it is better to, go for something that at least, works on average with many people. But wouldn't it be nice if we could know for an individual what will work and what won't? And there is some research that has been done. Who knows if it will lead anywhere, but I thought that I would mention it because I thought it was very neat, where they look at, so some people did MRIs of people who are depressed to try to predict who's going to respond better to medication and who's going to respond better to CBT. And they find that to some extent they can do that a little bit. And same with using EEG. So MRI, just to clear up. So MRI is, the machine that you go in and they really can look at your brain activity in real time, like they see the actual structures. EEG, on the other hand, is electrodes that you place on the skull, and what this tells you is more like physiology of, how your brain is working, to predict, again, like who will benefit from medication. So these are neat new developments. Who knows if, one day we'll be able to say, okay, you should have CBT and you should have medication. So until then, the choice is really, again, based on severity, preference, and those other factors. So now let me tell you about CBT. So it's really simple, a simple concept. So you have your feelings, you have behaviors, and you have thoughts. And it's about realizing that these three factors influence one another, like in every possible way. And I'll give you an example for like mood and thoughts. So, if I think this is so unfair, it's wrong, well, what's the emotion? Anger. Like that thought is associated with anger. If I think of all the people that died during the COVID and their family and just how painful all that was, the emotion's probably going to be sadness. If I think, oh my God, I've got an exam tomorrow, I'm not prepared, the emotion's going to be anxiety. So you could really, you could almost have a game where you have the thoughts and you have the emotion and you just, which goes with which, and you would be able to do it very easily. The other way around too, how mood can drive our thoughts. If there's kids that are misbehaving and running all over the place and making chaos, and I'm in a good mood, it's like how cute and how creative and how this is nice. On a bad day, in a bad mood, it's annoying. The thoughts are going to be more about they could behave better. So that relationship really goes both ways. Then if we want to take the relationship between mood and behavior, I mean, that's an easy one. People will often say, well, I'm just not in the mood. I'm not in the mood to go for a walk. I'm not in the mood to do this. So, mood driving behavior. And it goes in the reverse too. So, I might be more of an introvert and sometimes have to force myself to call people, but almost with no exception, when I do, I feel better after. Like, I feel really happy that I spoke to whoever I spoke to. So that's the behavior driving the mood. And, in terms of thoughts and behaviors, it's another obvious one, right? So I will think that I need to get up and I need to get dressed and I need to do all those things because I need to go to work. And I will then do it following those thoughts. And to reverse, if I spill coffee, I'll have thoughts in my head that will come from that behavior. So the point really is that these things are interacting together all the time. And what happens in depression is the feeling is clearly depressed mood, sadness. The thoughts are very negative. So, I'm useless. This, like, nothing matters, which of course then will drive the behavior of not wanting to do anything, or not wanting to see people, not wanting to engage, which then, further decreases the feelings of sadness, wordlessness, and so forth, which increase the negative thoughts, and on and on. Now, what's good about that, though, is that we can't change the feelings directly. If we could, everybody'd be happy all the time. But we can change the behaviors and we can change the thoughts. And so, the same way that the relationship between these components can bring you down, they can also bring you up. And that's exactly what we want to do with CBT. So the first component, like if we target the behaviors, so the two targets, just to be clear, is the behaviors and the thoughts. So with the behaviors, what we want to do is what we call behavior activation. So it's really just increasing activity, increasing contact with people. So it's basically doing the opposite of isolating and withdrawing. When they, like, a way that I like to think about this is that when they do research on happiness, what makes people happy who are happy, like what makes the difference? They find 5 factors, and they call it the PERMA model. And the 5 factors are positive emotion, so being able to experience positive emotion in your daily life, engagement, feeling like you're engaged in something, relationships, feeling connected. Then there's meaning, so feeling that you're doing something that matters, and accomplishments, so like little moments of like, okay, I did this, I did that, just feeling good about that. And so the point is that to get these, there's really only one way, which is action. If you stay in bed or you stay alone at home and don't do much, you're not going to get much positive emotion. You're not engaged. You're not relating to people. You're not finding meaning or making meaning. And you don't have much in the way of accomplishments. And the other, so it's really about taking action. Now I have to recognize that in the context of the pandemic, it poses a bit of a challenge. And I think that that's also what's contributing to people's mood being lower, whether or not, they meet criteria for major depression or for an adjustment disorder. But I think for everyone, getting our PERMA is a bit challenging because, for positive emotions, you'd say, oh, well, let's go to the movie, let's go to the museum, let's, go out and do something. And we're limited to home, at least at the moment. engagement, some people lost their work. It's, hard to then feel engaged, or at least it certainly decreases the level of engagement that someone will experience. Relationships, so not being able to see in person or at least close the people that we love can be a challenge. Having meaning in the context of uncertainty is also a bit more difficult, as well as, the sense of accomplishment. So it's a bit of a challenge with the pandemic, but it doesn't change that it is necessary to our well-being. And if you are struggling with depression, it still is important to take action to try to get more perma in your life. And there's a TED Talk that I watched not so long ago that I thought was interesting. It was Johan Hari, who was, his main point was that, there's these deep psychological needs that we all have, like belonging, meaning, feeling valued, and that these can be hard to come by in society today. And in the end, it's the same bottom line of you need to get engaged. Like, you're not going to feel like you belong somewhere if you don't connect with people. You're not going to feel valued if you're not engaged in your life. So action being super important. It helps to challenge the unhelpful thoughts. So, when you're active, it changes your thoughts. It's a distraction from rumination, from the negative loop. It limits disruption, so in your work, in your activities, social relationships, so forth. Now, you have to be realistic in that the issue, I think the primary reason that people withdraw in depression is that any activity, any action just takes so much more energy than it normally would. And then the pleasure that you get from it is not as much as it normally would. And so why bother? That's sort of I think what is driving a lot of the withdrawal. But you have to realize that yes, it's going to take you more energy than before. And yes, you're not going to have as much pleasure. But you know what? The pleasure that you're going to have is still pleasure. And you're breaking the inertia a little bit so that, with repetition, it will take you less energy to do things. So, it's a question of degree. You don't want to push too much, but at the same time, you do want to push a little bit. So what you can do or what we encourage clients to do to, find out what they need to do more of and less of is to just monitor what they're doing during a week and rate how depressed they feel, so that then you can look at the record and say, oh, look at that, when you stayed in bed, that was the worst. When you had lunch with a friend, oh, that was, that really seemed to have a good effect on your mood. You went and swam and, oh, that, really, again, bettered your mood. So it gives you some clues as to the activities that you want to do more of, less of, the places or the people that you want to interact with, maybe by Zoom, maybe by phone, if not in person, that you want to interact with more or less. Also time of day, if you're finding yourself more depressed in the morning, well then, schedule things for the morning that do you some good. What I would encourage in general, if you're able to put it in there, is exercise. because they've done research and it shows that it's really like a mild antidepressant. It really does affect the brain. It really, really helps. Go in nature. That also has been shown to improve mood. And luckily, I mean, that is something that we can do. There's no reason, at least at the moment, to go for a walk. If you live in Montreal, go on the mountain, just like enjoy the outdoors. Right now it's the fall colors. So go out there. Try to involve your five senses. That's another good way to think about it. So sensory experience is important, especially that with depression and anxiety is the same. You're a lot in your head. You're not so much into your body. And so involve your senses. If you have a pet, like it's a nice time to be able to interact with them in that way. Listen to some music, look at some art, or do some art if it's something that you enjoy doing. Try new tastes, pleasurable foods, smells. And again, keep in mind that, yeah, it might not bring you as much pleasure when you're depressed than when you're not, by definition, but it will still bring you some pleasure and be able to see and experience that. And also to try to connect with people. That's really important. So now the cognitive piece. So we talked about what we can do for the behaviors, but what about the thoughts? And thoughts are very important in depression. So if you think of reality, I mean, we don't see it 100% for what it is 100% of the time, that's for sure. So the angle, if this is reality, the angle that we take depends on our personality, depends on our past experience, it depends on our mood, it depends on a whole bunch of things. So we're seeing reality from our own little perspective. And so cognitive restructuring, which is changing thoughts, like cognitive for cognition, restructuring for changing. So cognitive restructuring is really about seeing different angles. So it's like, okay, you've got that angle, not disputing it, but like, let's look at the other ones. And I'll give you, an example that we also often give because it's a concrete example. You see someone on the street that doesn't say hi to you, that that can go many different ways, right? So if you are prone to guilt, you might say, oh my God, did I do something? Did I not return a call? Is there a reason that that's what must have happened? And then you're going to feel guilty. You're going to next time try to avoid the person maybe because you're feeling badly. If you are someone who's more prone to anger, you might say, well, who does he think he is, since his promotion doesn't say hi to, anybody else in the department? And then you're going to maybe act rude to the person. And, so again, it's going to affect your mood, your thoughts. So your thoughts are going to affect your mood, going to affect your behavior, and so forth. The reality is, we don't know why the person didn't say hi. Maybe they're in their own, little world. I am sometimes just not seeing what's around so much. So it's about, recognizing that reality, there is a reality, and then how we see it is really perception. So it might be a reflection, an accurate reflection of reality, or it might not be. It might reflect a bias. And that is, in fact, the problem with depression, as well as with other negative emotion, is that it will affect what you see. So the fact that you're in a depressed mood, you'll focus, by definition, on the negatives, and the positives that are there might just not catch your attention. And then if you don't perceive the positive, then of course you don't remember the positive. What you remember is the negative. There is a concept by Barbara Fredrickson that I thought was interesting, because if you think about it, it's very true. When you have a negative emotion will narrow your field of attention. So if it's fear, if there's a bear in front of you, all you see is the bear, right? Like you're not seeing the pretty sunset. And the same with the negative mood of depression. You're really in your bubble under your dark cloud, and you're not, seeing all the possibilities that are out there, all the good things that are out there. And so what we want to do is, broaden that perspective, because, when you're happy and you're going outside, you're just like, oh, you're seeing the trees, you're seeing the birds, you're seeing that's when your field is wide, and that's really what we want to do. There's a fun test if you want to take it. It's on YouTube. It's an old experiment in psychology where they, I didn't pass the test, I could tell you that. There is a gorilla, an obvious gorilla, in a basketball game. But you are, if I remember correctly, you're looking at the ball or the players. I'm not sure what it is, but you have a task to do that you're focusing on. And the point is, you end up not seeing the very obvious gorilla that you see, when you look at it afterwards. But point being that's the issue with depression. You're seeing all the negative things, but you're not seeing the positive ones. And so we need to really work on that. So how do we work on that? Well, we try to bring up evidence that your negative thought might not be 100% true. So we do, maybe I'll move to the other, maybe I'll just go straight to the thought record. So you write down what the situation was, what your emotion was, the negative thought. Then the next column, which is the fourth column, you would write, what is the evidence that your negative thought is true? Typically, you have no problem, we have no problem doing that, because, if we have a negative thought, we know why. Like there's, of course it makes sense. But then the next column is for what's the evidence that the negative thought might not be 100% true. And here you want to look at, is there any objective evidence? Like if you were in a court of law and was trying to prove that this thought might not be true, what would be your strong arguments? You can also think about a friend. So if a friend knew that you were having this negative thought, what would the friend tell you? Or the reverse, if your friend had this negative thought, what would you tell your friend? You might try to take some distance, and say, okay, in 5 years, 10 years from now, will I see this differently? Is there like a different perspective that I can bring from that angle? Or another one is, let's say that I was in a good mood. How would I be thinking? So you can, you're trying to come up with what's, again, that other angle that I was talking about before. If you have reality, which, your negative thought is the angle that you took initially, but what are the other angles? And there's really two ways to work on negative thoughts, to challenge them. One is the accuracy, which is what I just described. Like, is this negative thought 100% true? No, it's not, and this is why. But sometimes the negative thought might be true. And then at that point, what you want to ask is, okay, is there a more useful way to think about this? So I might think that I hate physics and I'm really not good at physics, and I've got a ton of evidence from CJAP that I'm not good at physics. But if I had to pass an exam in physics next week, I think we can all agree that those would not be useful thoughts. They might be accurate, not useful. So, a better thought might be that I will, do my very best. And I'm sure that, if I read and reread, I'll understand certain things. I'll give myself more time. Like there's, things that I can do. And, if I don't pass the exam, I'll pass it the next time. Or, there's like more helpful thoughts that I can have than all the negative ones. So let me give you an example of, a thought record or cognitive restructuring. So, someone might think my partner doesn't care about me, which is, then will lead to sadness, loneliness, a lot of negative emotion. The evidence might be, well, he doesn't say I love you very often. He didn't buy me anything for my birthday. So he doesn't care about me. And, you can see how the emotion is very negative. And now, okay, what's some evidence that maybe my partner does care about me? Like if I was in front of a judge and I had to build that case, what would I say? Well, he often asks me about how my day went, almost every day. Like he really, wants to know. He took care of me when I had the flu. He often asks me to go and do things with him or proposes things. So that is some evidence. And you can see how by now I'd probably be feeling a little bit better. Any more realistic thought might be that, okay, my partner might not demonstrate that he cares for me in all the ways that I wish he did, but he does in many ways. And that's more realistic. More realistic, but also more importantly, leads to better mood. And I'll give you some more concrete examples of some unhelpful thinking styles. So there's all or none thinking. So whenever you hear yourself, always, never, totally, like entirely, it's rarely accurate. You can say that, I often feel like, I often do, what do I do often? Anyway, you can come up with, different examples of, I often leave Kleenexes all over the house. But I don't always leave Kleenexes around the house. Whenever you catch yourself using one of those words, question it. And also if you have a very global statement, so people will say, oh, I'm a bad mother, I'm a bad receptionist, or I'm not good at what I do. And what you can do here is try to see it on a continuum. So you can, first of all, break the concept into different pieces. So, what's a good mother? I mean, there's, many things about being a good mother. What's a good receptionist? There's, many different tasks that someone does. And so on a continuum, like if we go with this example, you can see that, okay, maybe the person's not so good at networking and maybe they want to work on that or not. But they're good at, answering the phone, preparing documents, financial tasks. So all in all, there's strengths and there's weaknesses, and that's a much more realistic view than I'm incompetent. You're competent at certain things and less competent at other things, and that's okay. Another thinking error that is common is, focusing on the negative. So like I said before with the gorilla example, seeing, the negative and not seeing the positive. So for instance, you give a presentation at work and there's this one question that you did not answer, that you weren't able to answer to your own satisfaction, but you answered all the other ones, but yet that's the only thing that you think about. So you really want to try to reframe and maybe keep a gratitude journal or a journal of things that you do well, like be able to see that on a daily basis, as opposed to focusing on what doesn't go as well. There's assumptions. There's two main ones. So one is mind reading, so knowing what other people are thinking, knowing why they behave in certain ways, their intentions. So it's reading a lot that we can't. We really, have curiosity and ask. What someone's intention is or what they're thinking, but don't take it in imagination. Then there's fortune telling, which is similar. So it's being able to foresee the consequence of an action without even doing it. So, and typically in depression, it's that it wouldn't work. So, if I ask this person out, they're going to say no. If I do this, it's not going to work. So again, there's only one way to find out, which is to do it. So don't assume, ask people and find out. Another set of cognitive distortions is what we call them, so thinking errors, is unrealistic expectations. And that's when you hear yourself saying I should or I must in a very rigid way, and you use it to beat yourself up, like to criticize yourself, instead of using it to be helpful. I mean, some rules are helpful. We use rules, and it's okay. Again, if it helps you to strive and to get somewhere, and if there's flexibility in there. So, try to focus on values. And I like this cartoon. It's like, you were so happy and energetic yesterday, you got so much done then. So it kind of implies that, well, every day you should be really energetic and get a ton of stuff accomplished, which I think if you're not depressed is already unrealistic. And if you're depressed is even more unrealistic. Then you have labeling, which is the last cognitive distortion that I will mention. So using words, like you're a loser, you're a fool, a failure, an idiot. You can do a stupid thing. Everyone does stupid things. I certainly do. It doesn't make you a stupid person, though. There is a difference. And the importance is twofold. One is that repetition leads to belief. So you could convince a population of something that's totally false if you repeat it often enough. So repeat, repeat, repeat. People will, oh yeah, did you hear? Do you know that? And so if you repeat to yourself these things, you're going to really believe them. So don't do it. And the other effect is really about language. It affects our thoughts. It affects how we feel. There's interesting research that I remember from undergrad course from Elizabeth Loftus, where she, just looked at, if you asked, I don't remember the specific words, but it was something like, if you ask people how fast were the cars going when they hit versus how fast were the cars going when they crashed, you're going to get a very different response with the cars going a lot faster when they crashed, even though people are shown the same video. So again, language has an effect. So we all talk to ourselves. That's normal. Just make sure that that language is a nice one, a kind one. So you want to be your inner coach. And you can see the difference, if you're telling yourself like, I'm a failure, I'm going to disappoint people, I can't make any mistakes, otherwise it's garbage. You can see how that's going to lead to anxiety, depression, like, you know, the feeling's going to be very negative. Then your behavior is like avoidance, procrastination, just don't want to deal with it. And then the experience is, you know, more likely to be negative because of those behaviors. But even if it is positive, chances are you'll then interpret it in a way that fits with this. And then it just, you know, feeds back right into see how you're a failure and how you're disappointed and so forth. So it's a self-reinforcing cycle. Where on the other hand, if you're able to tell yourself, like, you're capable, like learning is really a process, people make mistakes, it's really actually one of the best ways to learn. If the mistake is not, if the consequences aren't too bad, you do want to make mistakes. And it's going to lead to positive mood, self-confidence, useful behaviors. So you're actually going to prepare, consult, and then, you know, the experience is more likely to be positive. But even if it's not, you're able to see that, hey, I'm more advanced now than I was before having the experience. And it's really proof that, hey, you're capable and you're learning. And again, it's a feedback loop. So what if you, so I think I covered both. You know, just to maybe summarize at this point, you can't change your mood directly, but you can change your thoughts and you can change your behaviors. And at the level of the behaviors, it's really moving, like instead of moving away, it's about moving forward, like towards, and being engaged, like re-engaging in your life. And at the level of the thoughts is to say, okay, can I think about this in a more realistic or helpful way? And trying to work on those thoughts and being kind to yourself. And when you're talking to yourself, be nice. Now, what if you're trying to help someone who you think is, you know, going through a difficult time or suffering from depression? The most important thing that you can do is to be there. Sometimes people get nervous and they're not there because they feel, I don't know what to do. And so they avoid. And no, you just be there. Don't need, if you don't know what to do, fine. You don't have to do anything. Just make yourself present. And you can ask what the person feels that they need, both as at the psychological level, like, do you want me to, you know, just listen to you? Do you want me to try to solve this problem with you that you're talking about? And then in more practical terms, you know, like, because again, you know, especially if the depression is more moderate to severe, people have difficulty with completing their tasks. So you can offer to, you know, come and bring them some food, or do the wash for them, or, you know, help out in a practical kind of way. You want to encourage activity, pleasure. So, you know, you can propose certain things. And again, it's about the balance of encouraging movement, but at the same time, you know, you don't want to push too much either. So it's a question of amount. And you do want to foster hope. That's really important, you know, that it will get better. Like, you're going through a tough time now. Sorry about that. But it will be better. And if you have any concern about suicidality, you want to talk about it, you know, in a non-judgmental, calm way. Give the person some resources. You know, it's not true that avoiding the topic will avoid the person having these thoughts and what could follow. It's you're better off, opening that door and discussing it so that then you can act appropriately. So give them some resources, or if you think there's imminent risk and the person is wanting to go to the hospital with them, or call 911 if even if they don't want, but you're truly really concerned. Some of the factors that you might want to consider in terms of risk is if there's substance abuse, impulsivity, hopelessness, previous attempt, or very serious psychopathology. These increase the risk of someone committing or attempting suicide. So you want to keep that in mind. So again, it's better to talk about it and encourage action if action needs to be taken. So the 5 tips in conclusion. So tip number 1, be active. You may feel like you don't have the energy, you don't want to, but it's really part of the way out. So exercise, be in nature, be in the moment. The 5-minute rule is this idea that if you really don't feel like doing something, tell yourself, I'll do it for 5 minutes, 5 minutes only. If after 5 minutes I still don't want to do it, I'll stop. But usually, it overcomes that initial inertia. And oftentimes, you'll continue doing it once you're engaged. Tip number 2, see people. Don't withdraw. People will be happy to be there for you. Tip number 3, challenge your negative thoughts. Are they accurate? Are they helpful? Is there a different way that you can think about this? Tip number 4, be kind. Treat yourself with kindness, patience, compassion. Have realistic expectations. Life is not a performance. It's okay to just be. In fact, you want a balance of, doing things and being. Take care of your health. Eating, like I didn't mention these things, but it's important, obviously important, that you try to make room for sleep, try to eat well, even if you're struggling with appetite. Exercise. And tip number 5, keep in mind the PERMA model. So positive emotions, engagement, relationships, meaning, accomplishments. Try to see how you can get more of that in your life, even in the context of the pandemic. So some book recommendations. There is Mind Over Mood by Greenberger and Podesky. It's a workbook and it's really well made. And the Feeling Good Handbook by David Burns is really a good book, especially for cognitive restructuring. Like it really talks about negative thoughts and how we can change those. So I thank you very much for being there. And I also want to mention before ending that we do at the clinic run group therapy for depression. It's ongoing, so we get people on a list, and when we have enough interested participants, we begin the group. And it is using the Mind Over Mood book. So it's really structured. So we, in the group, do some thought records and do some activity scheduling and, do different components. So it's not that there's an element of support, in that you're in the group with people that are going through something very similar. But it's not a support group per se. It's really more psychoeducational. So getting, again, some skills to cope with negative emotion. So thank you very much.